Hello, everyone. It is now 2:03, so we're just going to go ahead and start. If anybody has a question, please type it out at the end of the presentation, and I will respond to you as possible in regards of this presentation only. So we're gonna see pain and crisis management for older patients. And it is just a guide for non-clinical caregivers, meaning people that has no licensing to perform clinical stuff or procedures that are pertaining to nurses or somebody that is clinical. It is important to know how to manage crisis, especially working with elderly. There's different type of crisis. When you think of crisis, you usually associate with somebody having a behavior, but there's different types of crisis that somebody has, and that's depending on whatever needs they have. So everybody has different needs, and everybody can have a crisis on different stuff, not necessarily on having a behavior, but there's medical crisis and unmet needs as well. So that's what we're gonna cover today. And let's see. So can a crisis vary person to person? Can somebody type in the chat, please? Okay. Yes. Crisis can vary person to person, and that's because of the reasons that I gave at the beginning. Everybody has different needs, so therefore, everybody can have different type of crisis. So let's just gonna watch this video. Hold on.
An elderly man picked up the phone last week and placed a heartbreaking call to 911. Turns out it was a wake-up call about a growing problem that has gone unnoticed. Here's Dr. John LaPook.
Clarence Blackman is an 81-year-old Army veteran battling prostate cancer. But cancer wasn't the reason he called 911.
What I need is someone to get to the grocery store and bring me some food because I need to eat something.
I thought, well, I got to have an instant response. And I figured I know that 911 responded very quickly.
A widower since 2011, Blackman came home from the hospital last week to an empty fridge and had no one to help him. In a recent report, Dr. Maria Carney of North Shore LIJ Health System says a quarter of Americans over 65 are at risk of becoming so-called elder orphans.
It's hard to age even when you have a good support system. So you can only imagine if you don't have anybody with you to help you.
About a third of Americans aged 45 to 63 are single, a 50% increase since 1980. The report says elder orphans not only combat loneliness and depression, they lack assistance for their basic needs. 911 dispatcher Marilyn Hinson was so struck by Blackman's call, she took a detailed list of his food requests and personally delivered them.
I've been hungry. A lot of people can't say that, but I have. And I cannot stand to see anybody go hungry.
Blackman was then inundated with donations and offers to help.
One lady sent me 6 cans of Spam. I thought, well, God, I'm in heaven now. I got 6 cans of Spam.
Dr. Carney had a great idea. Develop an app where you put in a zip code and are told about the local resources available.
What a wonderful thing that dispatcher did. Doc, thanks very much.
So from this video, we can see that this person was having a crisis, right? And it was not necessarily something medical, an emergency that was because of something medical. What was it? Exactly. He was having a need for food. He didn't have any food at home, so that was his crisis. Despite being diagnosed with cancer, cancer was not the reason why he called 911. He called 911 because he was needing food. And as he explained in the video, the only he knows that the only ones that would respond right away was 911. So it is it is a lot of people can have different crises. People have again different needs. They might not look like something like for us relevant, but again, everybody has different needs. So it is important to know what to do when there's crisis. First responders, at least a dispatcher that took the call, was kind enough to not, disregard the call because many others would have just informed the person that it was not a medical emergency, so they could not do anything. But in this case, the dispatcher was kind enough to listen to the person and also take action. She went by foot and then uh, took it to his house. So it is important to understand that people go through different processes, different things in life, and just be kind of know what to do. Um, it is also important to understand pain. People, especially in the elderly community, has chronic pain, suffers from a lot of pain, and we all experience pain differently, and we don't experience pain the same way. Somebody that is having, I don't know, back pain is not the same as I would be experiencing the pain, right? It would be different. We all have different levels to pain tolerance. So it is also important to understand there's going to be people that will end up at the hospital because or at the ER because they were having extreme pain. Therefore, they call emergency services. Pain and crisis are common in elderly patients. Uh, and effective management can significantly improve their quality of life. So, caregivers play a crucial role in recognizing and managing these issues. Once again, we keep repeating caregivers are the people that spend the most time with the clients, with the people. So, you're able to recognize and identify issues that they might be having and know what to do if this happens. There's different types of pain. If you already attended a pain management training, there's an explanation on the different two types of pain. People can experience acute pain, which is short term, usually from injury or surgery, and chronic pain, which is a long lasting, often due to conditions like arthritis. There is also neuropathic pain caused by nerve damage. This is because of diabetes for usually. And those are the different types of pain that people can experience and that would lead them to have a crisis. Recognizing pain is important. Verbal cues. When somebody is having pain, there will usually be complaints of pain. They will tell you they're having some pain, and it is important to recognize it, not ignore it. There's a tendency that family members or caregivers ignore when a client has expressed that they have pain. They think that is because that people is getting old, is or if they are constantly complaining of pain, they do not pay attention, therefore they do not act to do something about it. So whenever somebody is in pain, it's important to pay attention, because the same way that you wouldn't like going to the doctor or to the dentist saying that you are having toothache and being ignored, so it's the same way. And that's because they are not experiencing your pain, right? So how do you feel? You feel frustrated. People have behavioral and disruptive. They can be disruptive. They can their mood changes. They tend to get grumpy, and that's because of pain. But also, it is important to pay attention to the nonverbal cues. Some people won't express pain. Some people, especially if they're not able to speak, or if they have dementia, if they have Alzheimer, sometimes they cannot express pain with words. However, you will see nonverbal cues. And this is gestures that you might do with your face, uh, the face that people make when they're having pain, when you're trying to get them up from bed. Um, you can see their faces. You can see their reaction to an activity or movement. You can see through their face. They might not again say anything, but you can see when somebody is in pain. Then and there's grimacing, moaning, or reduced activity. Those are also nonverbal cues. There's also behavioral changes, as I said, with somebody's experiences and pain. People would have an increased agitation or withdrawal. So it is important to pay attention sometimes to that. You want to find a reason why somebody is acting the way that they're acting, and not just uh, attributed to because they're old or they're rude. Sometimes it's not towards you. Again, it's that condition that they're having, and it is your job to find the cause and make the proper report and proper take the proper actions in order to help that person. There's pain management techniques that you have learned in the pain management um, training, and it's access into care anytime, anywhere. So there's medications that are used for pain management, but there's also non-medication treatments that are used. So know what you can do if if they're having some pain and they have been prescribed with medication for pain. Just remind them that to take a pill. Do not encourage them to take something that is not in their list, as it can cause other reactions, and if mixed with other medications. So for the most part, a lot of people can take Tylenol, which is a painkiller. So just making sure that they're not like again allergic, or they don't have any reaction to it, known reaction, so you can encourage them to take that. These are over the counter medications they can use. And again, you don't have to give in to them, because if you're not trained, and also it is not under the scope, your scope of practice, you can violate some codes. So it is not your job to, oh, like, I remember this person is in pain, so I'm gonna stop by the pharmacy and get them some medication. Have the family and themselves get their medication and just have it at home, and just encourage them. They take it on their own, as needed. Uh, for non medical treatments, there's physical therapy and relaxation techniques, as well as heat and cold, depending on the type of pain that somebody is experiencing. You can apply some cold to it. This will relieve inflammation. Again, it depends on what type of pain they're having. And there's other pains that can be managed with some heat. So you do not want to apply something that is way too hot, something that is just tolerable for them. You can encourage them to do it. And this will help, for example, with back pain or something like that. It is also important to know crisis situations that can happen, identify crisis situations. There are three types, main types of crisis. It could be a medical emergency, it could be a severe pain episode, and it could also be behavioral crisis, right? When it comes to medical emergencies, it could be a heart attack, it could be a stroke, it could be a fall, but for severe pain, again, people have different tolerance to pain, so they can have unmanageable pain that they will end up having a crisis and end up at a hospital. Behavioral crisis could be severe agitation or confusion, disruptive behavior, I like being physical aggressive or trying to self harm themselves. Also, it is important to know the safety and emergency procedures for whenever a situation happens, you know how to act. It is important as well to know how to act and being alert for hazards, especially when it comes to you want to prevent how the things that you can prevent is falls, for example, accidental poisoning, burns, electrical shock, and choking. Those are things that are there ways that you can prevent that. Um, how you identify crisis and how you react to them is important. Type of crisis again could be medical emergency, and you are to identify a possible condition to know how to react. Somebody could have a heart attack. So if they would go unconscious and they would go not breathing, then you would start administering CPR. When they're gone unconscious and you don't find any vital signs there, you start performing CPR, and it's important to call 911 right away. That's in the case of something related with the heart. You never know when somebody is having a heart attack. There could be signs and symptoms that could be similar to that and could be a different condition. But whenever it is, there is no vital signs or there is no consciousness on the person, then just start performing CPR. Whenever there's a stroke, again, you will start seeing physical symptoms. So it is important to be familiar with what are some of the signs for a stroke. And it is important to call 911 and provide first aid. When it is something related to pain, it is important to assess pain level, how high the pain is. From a scale from 1 to 10, how high it is. If it is at 9 or 10, it is a severe pain that has to be, addressed immediately because people start having other crises. They could start having anxiety attacks because of the pain and shortness of breath, so you might get confused too with different conditions, but if they're experiencing pain, always assess what's the pain level and administer pain relief again. If the person has some medications at home that are for pain, just have them take something. And it is important to follow up with the healthcare providers. If it is unmanageable, of course, a lot of people will end up at the ER, not necessarily have to call 911 again, because that's first responders that are to attend other types of accidents or conditions, but if the person has nobody to take them to the ER, there has no family, no friends, no caregivers that could drive them to the ER, they are alone at home, then they would end up calling 911. There's also, again, behavioral crisis. The most important is ensure safety. You want to keep yourself safe, but you also want to keep the persons safe. So it is important to remain calm, but also trying to remain to calm the person down. There's different techniques that you can learn how to calm a person down whenever they having a behavioral crisis, and this might not work for everybody, but also, if you never know if you don't try it. And seek for medical help. It is important to seek for medical help whenever a person has one of these crises. They might have to need some medication. There might be a condition that is causing this behavioral crisis. So it is important to seek for medical help and monitor and support. For immediate crisis response, know what to do next. The first thing is to stay calm. You cannot take care of things if you are not, uh, if you don't keep yourself a level head. So it is important to remain calm, ensure safety, remove any immediate dangers, contact emergency services whenever needed, and provide comfort, reassure the person, and support them. Has anybody has experienced any crisis? Nobody? Has anybody had a person fall in front of them? No, so far. Okay, that's good. However, it is important to know what to do because at some point can happen. Again, it can only happen with people that you work with, but also in your family at your own home. There could be a crisis that you will need to react. Just I have had to give my mom CPR. Oh, how was that experience, Nicole? It is scary, right? Yes, it is scary. I myself also had to do CPR at one point during COVID times. Um, I was already working for San Isidro Health. At that time, I was just working in the therapy department area. But because we had our clinics, or not our clinics, but our pay centers closed, we were not having people coming in for physical therapy. So I was basically just helping to follow up on post hospitals or falls or things like that at home visits. But at some point, and they were needing somebody to go with one of our participants to an appointment, and they didn't have anybody. So I went. I did provide companionship for this person. to go with her to her appointment. But when we were leaving the clinic, as some of you might know, we provide transportation services. So transportation has used the right to pick us up. I placed a participant who was in a wheelchair in the van that we use for transportation at Pace. And then I started hearing somebody screaming from the parking lot. Somebody was like having just a crisis, right? Because that's how it sounds when somebody was screaming for help, and I was like, what is going on? So I look out the window and I saw that lady was asking for help from the car. So nobody was approaching them. Again, we were at a doctor's office where there was nurses, medical assistants, there were doctors, and nobody was doing anything, right? So I approached the person and I asked what was going on, and then she could not even talk, but she was pointing at the car, inside of the car. I look and there was a person laying on the floor in the car. It was like a modified car. So the person was laying down and was not conscious. Of course, my reaction was to approach and I assessed the situation again. You need to keep your level of calmness, right? So it was my first time doing CPRs, and I approached it and I see that there's no signs. There's no signs of breathing. There's no pulse. So I start doing CPR. I start performing CPR, and I start asking other people because it was a wife for this person. She could not even focus on anything, right? She was having a crisis because of the situation. So I had to ask somebody else to call emergency services while I was doing CPR. Again, it was COVID times. So when you do CPR, one of the things is giving people air for the lungs, right? But it's COVID times. It was 2020 still. It was December. We still didn't know a lot about COVID. We only knew that people was getting sick and that it could kill people, right? Especially seniors. So of course, I did not have any equipment to give this person air. I could only do CPR or um, push the chest, the push in the chest. So that's all I could do, and at this point, that's all I was able to. Even if I wanted to do more, that's all I could do. That's what I was trained for. I was the only person that was, reacting in a calm manner and giving the other people instructions. Because usually, whenever there's a bunch of people around, you might think that a bunch of people will call 911. However, surprisingly, when there's a lot of people, usually nobody calls 911, right? So it is important to directly ask somebody for that help. And if you're alone at home, you want to do it on your own, of course. You want to put it on speaker and do CPR. So it was a scary or not as scary, but it was my first time doing CPR. So of course you have the nervousness of what do I do? So all I could do is what I remember from the classes of CPR, and I did CPR until emergency services arrived. After that, they started helping, and I left. That's all I could do, but I did my part. At that point, the person was cold and the color of the person had changed. So at that point, you already know that the person might not be alive anymore, right? But I was not going to tell the wife oh, he's dead. Or just to stop doing CPR, because it's not up to you that you cannot um, pronounce somebody dead. It is a job of the doctor. So all I could do is pretend that the person was alive and just do CPR. So that's all I could do. Whatever happened after, I'm not familiar because again, I just made sure that I left the person that I was accompanying for the appointment, that I left the driver with the person, just making sure that she was okay, right? While I was taking care of this other thing. So it was at an unexpected moment. I didn't have in mind that I was gonna do CPR in a random clinic where there's a bunch of doctors and nobody came to help. So you never know when you're gonna encounter different types of crisis. So it is important to know how to proceed. Moving forward, um, communication. Always keep communication. That's important with the patients. If you're with a patient, they had a fall or they had a crisis at home, they are having high pain or behavioral crisis, you want to use simple and clear language and listen actively. A lot of times you just need to listen how they feel. This will make them maybe feel calm, and it will help you as well. With families, keep them informed and involved. It's always important to make them involved in the situation. If the person had a fall, it is important to know what to do when a fall happens. I'm not sure if you have been trained on that, but it's important to know how to proceed and inform the family, inform the daughter or whoever is in charge of the person, because you want to let them know, especially if the person has to be sent out for um, to the hospital for check. But also you wanna uh, um, document that, right? Because you want to make sure that if you work through an agency, let them know so they can follow up with medical professionals. With the medical professionals, it's important to follow up after having a crisis, and it's important to provide clear, concise information. Whatever happens, that's what you have to let them know. Any details that can help to gather information. Support resources. It's important to create healthy communities. There's local support groups for caregivers and patients. There's online resources. We keep mentioning, online trainings, education that you can have access to know what to do in specific cases. Professional help, identify when to seek advice from healthcare professionals. Anybody has a question? Does everybody know how to do first aid? There is fall prevention trainings, and that there is a part where after somebody fall, um, basically just want to make sure that the person is okay. Whenever a person falls, you don't try to catch them, right? Because you can hurt yourself. So you can only assist them onto the floor and follow from there. If the person falls, unfortunately, you can't do anything to prevent that. What you do after is you assess the situation. If the person is conscious, if the person didn't hit their head or didn't have any injuries and they are able to help you stand up, then you can help them. If the person cannot stand up at all, you do not try to get them off from the floor. As um complicated it might sound, if they cannot help you get up, you have to leave them on the floor, unfortunately. And you have to call emergency services, meaning 911. Again, if they cannot help you to get themselves on their own and you just help them, you cannot do anything. You will leave them on the floor and call emergency services because you don't know if they had an injury. So MTS, they will help. They are the ones that are trained to assess the situation and take them to the ER for a check. So you do not try to get them up. After a fall, whenever it happens, you know what to do. You can only assess and make sure that they're okay, right? That's all you can do. But there is trainings on fall prevention, of course.